This is Dr. Mary Whipple. She's a postdoc fellow in the Division of Geriatric Medicine and General Internal Medicine at the University of Colorado, Auschwitz Medical Campus. She was awarded in 2017 the MNRS CANS Dissertation Grant Award. The title of her grant was Diabetes and Sedentary Time in Outcomes of Exercise in PAD. Dr. Whipple received her doctorate in 2019 from the University of Minnesota.
Well, good afternoon, everyone. Thank you for the opportunity to be with you. Start with a beautiful photo of our Anschutz Medical Campus in Colorado. Look a little bit greener here now, or in this picture than it is now, but still a beautiful place. So I'll tell you a little bit about the research that I did as part of my doctoral program and where that's led me. So peripheral artery disease is a very disabling condition. It's caused by a buildup of plaque in the arteries in the legs that can cause pain, aching, cramping, and other symptoms in the thighs, calves, or buttocks when people walk. It's very common. It actually affects about 10% of Americans over age 60, and that prevalence is increasing in part due to increased prevalence of diabetes. The first line therapy for symptomatic peripheral artery disease is what's called supervised exercise therapy. It's typically done on a treadmill and involves walking bouts to try to increase endurance and increase stamina over the course of oftentimes 12 weeks. And it is guideline recommended therapy. In fact, the timing of it was in 2017 in May, the Centers for Medicare and Medicaid Services finally made the determination to cover the cost of supervised exercise therapy for PAD. And so that was really well timed with actually receiving this grant from MNRS to do my dissertation research. One of the challenges, however, is that comorbid PAD and diabetes might actually be associated with poorer outcomes of exercise therapy. We know that folks that have different surgeries for their peripheral artery disease tend to have poor outcomes if they have diabetes. One of the things I'm interested in is sedentary behavior, which there's been a lot of research, especially in the last 10 years, linking sedentary behavior to poor health. And importantly, sedentary behavior is different from physical inactivity. So you can be both physically active, achieve exercise guidelines, but also be highly sedentary. And what we know from starting exercise programs is that some people might actually compensate by becoming more sedentary when they start an exercise program. So I wanted to see if sedentary behavior could be a factor in how much benefit people see from exercise programs. And so the aims of the grant were to evaluate the effect of supervised exercise therapy on objectively measured sedentary time in older adults, both with and without diabetes, and then to see if changes in sedentary time early on in their exercise program was associated with the response to the exercise program. Did folks that were more sedentary perhaps not see as much of a benefit? And so we recruited 53 older adults from 5 different clinical sites across the Twin Cities metro area in Minnesota. And participants wore an activity monitor to give us an objective measure of their physical activity and sedentary behavior, and completed some measures of physical function and quality of life at baseline, 6 weeks, and 12 weeks. And so what we found was that diabetes was actually not associated with a blunted response to the SET, which was actually wonderful news to see that patients with diabetes could actually see just as much benefit from the exercise program. We also found that changes in sedentary time were not a significant predictor of change in walking distance from baseline to 12 weeks. But what was really interesting is that non-response was actually quite common, and non-response in the primary outcome of walking distance. You can see on the right here is a waterfall plot showing the variability in response from patients who actually got worse in their walking ability over the course of those 12 weeks, despite adhering to the exercise program, to a wide range of improvement as well. There was non-response was common in that primary outcome, but importantly, everybody improved in at least one outcome. In terms of dissemination and next steps, the results of my dissertation have been published. The first paper was published in the Annals of Vascular Surgery last year, and the second paper was actually just published in the Western Journal of Nursing Research. It's online ahead of print at this point. So in addition to these 2 publications, I've done presentations at MNRS, at the American Heart Association, Society for Vascular Nursing, and the Society for Vascular Medicine on some of the results from this work. In terms of where this has led me, as you heard, I'm a postdoctoral fellow at the University of And I'm using this training to gain more experience in some of the physiologic measures that we could use to understand how sedentary behavior impacts health. And so I have a couple small intramural grants funded through the University of Colorado, and I'm out here on an integrative physiology of aging T32 through NINA. I've also been really I'm very grateful to have been selected for funding through the NINR Clinical Research Loan Repayment Program this last year, which is also a wonderful resource. In terms of involvement in MNRS, I have been attending MNRS since I was the last year of my BSN program, and have been presenting most years. You can see on the right, I have some pictures of different posters over the years, and we have a paper that has been accepted for publication coming up at our meeting in March. Since I finished my PhD, I've started to become involved in competitive and student abstract reviews, as well as other service to MNRS through the RIGs. So while I was a student, I was the student co-chair of the Gerontological Nursing Science RIG, and I'm actually now just finishing up my tenure as chair of the Gero RIG. And so it's been a wonderful opportunity to leaders and gain a lot of experience over the past few years.